Hello and welcome. Today we're going to do the low back treatment, and so we'll begin, as we do with most treatments, with rolling, and you're going to take your time rolling. There's a couple of different ways to roll. The way that I prefer is to roll from this knuckle to that knuckle. Notice that my wrist doesn't bend. But you can also, because we have such a broad area, the other way is you can roll across these knuckles, so it looks like that. So I kind of go from one to the other just fluidly. Again, the one that goes forward is the one that I prefer, because I can do more detail with it, but we're doing a big area right now, so it doesn't really matter. So, taking your time, getting the low back, the glutes, the hamstrings, and gastrocnemius. Lower leg. Easy transition to roll your way over to the second side. And just do that at your will. You don't have to, just whenever you feel like going over to the other side, just go ahead and move. So I like to roll for a good long time. So if you want to pause this and roll for a bit longer, would be good. Over to the other side. All right, so we can do more rolling on your own time. The next step is finger springing the bladder channel. So I'm really going to focus on the first channel, which is the more medial one. So again, the measurement, you go from the spinous process, you go 1.5 cun out lateral on either side. That's the first channel. And I'm just going to do a line that goes down and just goes to behind the knee to all the way down here to urinary bladder 57. So I'll start here at the top. You can do one side at a time. You can do both sides at a time. I think both sides, the body mechanics is a little too hard. I prefer myself to do one side at a time, but find out what feels good for you. You might stop on a point and hang out. Stop in a landmark that you know your client is particularly tight on. And going down, all the way down in between the two heads, down to urinary bladder 57. So you can make a nice transition to the other side. I could probably reach, I can reach pretty easy from here and go down. So actually I think I'm going to do that just for the sake of the camera. I really, probably halfway I should be over here, but let's go ahead and do it on this side because there's no compromise of my body mechanics on the upper back, on the back. So again, this is a vibration, creating a vibration, goes deep into the body. And again, look at my arm. See a jiggle? You want that. You may not want it on the other parts of your life, but it's a good sign that I'm getting a good vibration. reaching a little bit, but that's okay. All right. All right, so now the next thing we're going to do is we're going to press rub down the dew channel. So remember, the dew channel is the one that is right down the center of the spine. So working on the back, I usually like you guys to take your time doing these things. What you'll feel on the spine, if you're lucky, is I drew this on the board, you'll feel like a mountain. This would be the spinous process. And then you'll feel a little valley. That would be the space in between the spinous processes. And that's where the dew points are on the back. So I'm feeling for this divot in between the mountains. Honestly, you don't get to feel that all the time. Sometimes you just have to guesstimate where it is. Sometimes you feel it distinctly on one part of the back, and then it disappears and you can't find it. And don't assume that the spacing between the spinous processes is even. It's not. So if you feel a big gap, that's not unusual. So I'm going to come up. It is a low back treatment, so we would focus on this area. But I would suggest, especially if you're first starting, that you have the experience of feeling the entire spine, maybe from like T2 or 3 all the way down, just so you can get a sense of what it feels like to directly work on the spine. So yeah, this is considered an endangerment site. It's just, once endangerment sites are really like contraindications. You just have to understand what the structure is like and what to avoid. So I'm going to come in and feel for the spinous process. Here, I'm going to start here. So the other thing that you can do, if you can't feel pressing down, you can take your 2 fingers and pinch the spinous process and move up and down. And then what you'll feel is a wide area and a narrow area, and then a wide area and a narrow area. So then you'll be feeling for that narrow area. So here we are right here. So my thumb, in traditional Chinese medicine, the pad of your thumb is called the big fish, and the side of your thumb is the little fish. So I'm going to use my little fish for this. So I'm going to be on the side of my thumb, come into that space, and then I kind of go back and forth. It's a press rub. I just kind of move it. It's students usually ask, well, is it heavy pressure? Is it light pressure? It's a pretty medium pressure. It's not real heavy. It's not real light. And then I've got this space. I'm going to come in and find the next space and use my other thumb and do it too. And then I just do a leapfrog pattern. So now I leapfrog down to the next space, find for that space between the spinous processes, and then leapfrog down to the next space. So it's fortunate that today the person that I'm working on has distinct spaces between their spinous processes, so that makes it easier for me. So I'm so used to working through clothes that it doesn't hinder me in any way, but I know that a lot of times students like to actually feel the back when they do this, so that's entirely up to you and your client. Now we're in the lumbar area. Spaces are bigger here. And now we're all the way down to the sacrum. Okay. All right, so now after our finger springing, we're going to press rub the points just in the low back area. Later on in the recipe, we're going to do all the points that are on the posterior body. But this first time, we're just doing the ones in the lower back. So urinary bladder, 25. So I see when I do this on the table, my body is kind of twisted and I have to use upper body strength to do this. In my own practice and at school, it's okay for us to get on the table, but almost anywhere that you work, they have a rule that you have to have at least 1 foot on the ground while you're doing massage. If you work for yourself, that's not a rule. It's more of the therapist can get injured if they fall off the table thing than anything else. So, so I put my knee on the table, put my hands on the back, and then I just swing up. And I like to have one knee down, one knee up. So now I'm going to locate urinary bladder 25. So the iliac crest, spinous processes, come out 1.5 soon. And now look at my body mechanics. See how it's so much less effort. I'm just shifting my body weight into the point and then pressing. So for me, I much prefer to get on the table. But you can do this without getting on the table. So then do 3. I'm going to find the spinous processes. That's between L4 and L5. And this is do 3. So it's a compressed rub. Do 4. I'm going to skip the space between L4 and L3. And I'm going to come up to the space between L2 and L3. So this is do 4. So remember, the do channel rises up, and the confusing thing is that the bladder channel, the numbers go down. So 3, then 4. And now I'm going to use do 3 to come out and locate urinary bladder 23. The next 2 points, liver 13 and gallbladder 25, are the tips of the 11th and 12th rib. I'm gonna have you do this with them lying face down, and then later in the recipe, I want you to have the experience of finding the points side lying. Sometimes it's easier when you're going face down, and sometimes it's easier when you're side lying. And honestly, there's times when I can't find the tips of the rib, so I just go with my intuition and say, this is where I feel it would be. I'm just gonna let the energy follow my intent and go with that there. So again, I'm gonna come in, here's his iliac crest, here's the end of his rib cage. I'm gonna start right on the coronal plane, the imaginary line that divides the anterior from the posterior. It's right there. So I pushed in, then I pulled back, and what I feel is a little fingertip through the skin. So I'm going to come in, push in, pull back. Now, this can be incredibly sensitive on some people, especially if they're having low back problems. It can also be ticklish. So my preference in doing my work is I never want to make people incredibly uncomfortable. So if someone's really ticklish, I'm not going to torture them by tickling them, okay? I'll just hold it without any movement and just, again, let my energy follow the intent. So this would be gallbladder 25, the tip of the 12th rib, and now I'm going to come anterior and pull back. There it is. Sorry, guys, it was really easy. Usually it's good when you guys see me struggle, but this was just super easy. If it's not that easy for you, it's really okay. This is a tricky thing. So notice how I'm on the opposite side from where I'm working, because I want to use my leverage to come in, push in, so I kind of curl in, and then I just lean back. So that's how I'm using my body mechanics here. And then again, I would go over to the other side and do it on the other side. Again, I don't want you to look at my back, so just pretend that I'm on the other side, and I'll just say it again so you can hear it again. I'm going to find the iliac crest, find the rib cage, go to the coronal plane. If it's not there, you might come back a little posterior, but there are quite a few people that the tip of the 12th rib is more anterior, and some people the tip of the 11th rib is like way, way anterior. So again, come in, find the space, curl your fingers in, and then lean back, and you'll feel the tip of the rib. This is gallbladder 25, the tip of the 12th rib. And then come anterior and find liver 13, which is the tip of the 11th rib. All right. So now that we've pressed points, then we're going to do something to really make nice. So medium knead is the next step. And so now the next step is medium knead. So with a medium knead, it's medium pressure. So light knead is the lightest pressure, very, very light. Heavy knead is slow movement with heavy pressure, but medium knead, there's a lot of movement, and so you're using the movement to help you with the technique. So they see how he's moving, rocking nicely, that's what I want, and I like to push the erectors away from the spine. So really come in here, this is my favorite thing, everybody loves this. So medium knead. And I'm kind of scooping and using the heel of my hand and getting around. So sometimes I'll even throw in, I've got my hand on his iliac crest, so I'm kind of pushing down and pushing away. Kind of working that. And then I keep the body moving. I love this transition to go from one side to the other. I keep the body rocking as I come to the second side. And then I'm going to medium knead this side, and coming down and getting the legs. So I like to spend a lot of time with this. I really love to receive this a lot. So now I'm going to come around, and again, I really like this transition right here. And then I'll start to Na. So Na is to grasp, and again, there's movement when you Na. See how he's rocking? And because I'm working on a big area, I'm going to use all 5 fingers to Na. So, and then you can come in medial, out lateral, get the gallbladder channel. You can be meridian specific if you want, or you can just grasp the general area. It's really not easy to Na the back, so I kind of shift into the medium knead and then come around and really back the points. My thumbs are right on the gallbladder channel, and my fingers can come right into the urinary bladder channel. Na is one of those techniques, it really tires your hands out, but it's one of those ones, once you get used to doing it, feels really good, but it does take a lot of hand strength. So don't be surprised if your hands are really tired when you're first starting out. And then again, I'll just do a transitional move to come to the other side. All right. The next step in the treatment, I had to come up with a name for it, so I'm calling it the flat spinal twist, because it's a very subtle movement. There's not a big twist. The twist is very, very, very deep, and feels really good. So how I get into this is I need to get my hand all the way under to the as is. And that's one of the things that students usually have the most trouble with, is they don't realize how anterior the as is can be on people. So you really want to be able to feel the bone here, and your fingers are going to be on the medial side of the bone. So I use the rocking as a way to get my hands under. See, I come under and under and under, and now I'm all the way under, and I can feel his as is cupped into my hand like that. So now I'm going to stop moving, okay? This is the setup for the move. So now my hand's at the as is. I'm going to use the heel of my hand, and I'm going to push on the erectors and then push away. So I get a really strong pushing down. So I'm pinning it down. Then this hand is continuing to pin the back down. Now this hand is going to just lift the as is up. It's not a big movement, but it feels very, very deep. I hold it, and then I release. Then I go up a little bit higher, push down and away, really strong pinning it down, then lift the as is up. I prefer pretty much just the low back area when I'm receiving this. But I've had many people tell me that they enjoy it all the way up here, pushing down and away and lifting up. I'm just telling you that because that's the feedback I get. I don't get anything out of this, but some people do. So that's the flat spinal twist. So then you would go over to the other side and do it from the other side, but you're just gonna see my back, so I'll do it again because I don't want you to just look at my back. I'll do it again in time so that you'll be able to do this in the recipe. So again, my hands at the as is, push down and away, pin it down, lift the as is up. 1, 2, 3, and release. Go up a little bit higher, push down and away, lift the as is up, release. I'm going to do it one more time, a little bit higher, down and away, and lift. Okay. All right, so after the flat spinal twist, now we're going to do the points. We're going to repeat the points in the low back, and then we're going to go all the way down and include all the points that are in the posterior body in the recipe. So I'm just going to go through real quickly. I prefer, again, to get on the table, so I get my knee on and then swing over. So I'll go and find urinary bladder 25. And again, I'm using my body mechanics, the weight of my body to press rub. Urinary bladder 25. I'm going to use that to do 3, which is in between the spinous processes of L4 and L5. I'm going to skip the space that's between L3 and 4 and go up to the space between L2 and 3 for do 3. And then I'm going to use do 3 as a way to locate urinary bladder 23, so I'll come out 1.5 soon for urinary bladder 23. I could very easily do gallbladder 25. So on him, it's easy, and I'm getting it done bilaterally. I don't know that I would do it. Usually, gallbladder 25 is so sensitive that I really just want to do one side at a time. But if you feel really strongly that you would like to get them both done at the same time, I think what's going to be your deciding factor is how the person receives it. So if they're comfortable with that and you're comfortable with that, you can do that. So now I'm going to come in and do the second side. So on this side I did gallbladder 25, and then more anterior is liver 13, tip of the 12th and 11th rib. So on this side, tip of the 12th rib is gallbladder 25, tip of the 11th rib is liver 13. So I'm going to do something different now, just so that you can see a little bit better. I would normally press points that are right beside me, but it's going to be easier for you to see what I do if I stay on this side and then press the points and work over so you can kind of see a little bit better where they are. So, so now I'm going to go down the leg. So the next one I'm going to do is gallbladder 30. So I've got the edge of his sacrum right here. His greater trochanter is right here. These are my 2 landmarks. I'm going to go halfway in between, and even if you never knew this was gallbladder 30, you know it's a great place because it's right in the belly of the piriformis. So gallbladder 30. Some people, if they really want to use a lot of pressure, they'll come in with the elbow. That might be too much. That's a pretty common injury that I see going in massage school, especially in this area. It feels good, but people tend to overdo it, and then the next day people are sore. So be careful about it. So now I'm going to, can I bring your arm up? So now the next point, well, the next one is urinary bladder 36. So here's his transverse gluteal crease, the crease that goes this way. So I'm looking at his whole leg. I'm gonna go halfway in between for the point. And I vector a little bit slightly up, so it's right in the center. You can see my thumb kind of disappear. The ischial tuberosity is gonna be more medial. And if you know your anatomy, you know that the ischial tuberosity is the origin of the hamstrings. So that's also a good place to work. So a lot of times I'll come in and I'll get urinary bladder 36, and then I'll move in a little bit more medial and get the ischial tuberosity. Because if the hamstrings are tight, it's certainly going to affect the back. So that's urinary bladder 36. Now I'm going to go to gallbladder 31. So I'm going here, then here, then here. So that's why I'm changing meridians on you. So the easiest way to measure for gallbladder 31 is the middle finger touches the iliotibial tract. So I usually just take the arm, but I'm on this side. I usually just take the arm and do a nice stroke, see where his finger comes in, and boom. Now this one is a strike point. So you need to be careful when you go into this. This is a point that martial artists use to drop their opponents. So we're using it for healing. If you go into this too fast, you're going to make someone jump off the table and go, ouch. It can be very, very sensitive. All right. So now we're going to come down and we're going to do kidney 10, urinary bladder 40, and urinary bladder 39. So these are all in the crease behind the knee. I think I'm going to pull his pant legs up so you can see it a little bit better. All right, there we go. And again, normally I would be on the same side that I'm working on, but I want you to be able to see a little bit better. So I'm gonna just do this. So when I do these points behind the knee, I always have the knee flexed. It makes it much easier to receive, and it's also easier to locate the points. So right here, you can see this nice thick tendon. So the iliotibial tract is here, but this is the tendon of biceps femoris. So I'm going to come, the crease behind the knee is the popliteal crease. So I'm going to be right in the crease. I'm going to be on the medial side of the biceps femoris tendon. And my thumb's going to go in towards the center of the knee. So this is urinary bladder 39. And then again, another endangerment site, right in the center behind the knee. You've got your popliteal artery. You've got a big nerve in here. So I definitely want the knee bent, and I'm right in the center of the popliteal crease. And then we're going to go to kidney 10. Now this one's tricky because you have to find two tendons, semitendinosus, semimembranosus, but you're looking to go in between those two tendons. So it sounds invasive, but it just sounds that way. It's not really. So I'm going to come in, and sometimes this one is tricky. So I just lay my thumb flat and press down and see if I can feel the space between the two tendons. And then when I do, then I go flat, and then I feel the space, and then I just rotate so that my thumb goes in between the tendons. This is kidney 10. All right. And then from here, we're going to go to urinary bladder 57. The measurement is 7 cun above the medial and lateral malleolus, right here. I can actually, you're in between the two heads of the gastrocnemius, right at the beginning of the Achilles tendon. So I actually, because I've been doing this for a while, I can actually see and feel this point. I can feel the tendon, and then it just stops. See how my finger just stops right there? So this is 57. This is such a great point. So it's right between, in between the two heads of gastrocnemius, right at the beginning of the Achilles tendon. You don't have to have the leg up like this, but it's making it a little bit easier because I'm doing it from the opposite side of the table. It's making me much more comfortable. We got 2 points left for all the points in the posterior body. These 2 points I use all the time. I always sneak them in because they're great for low back. So on the lateral side is urinary bladder 60. And then on the medial side is kidney 3. So they're exactly opposite of each other. So you're going to be able to see urinary bladder 60 pretty easily, and I'll pick up the other leg to show you kidney 3, but they're exactly the same place. So here's the calcaneus, right? Here's the Achilles tendon, or calcaneal tendon. And then here's the malleolus. This is the lateral malleolus. So these 3 structures, I'm going to find the place where there's a hollow and none of those structures are there. See how my finger kind of goes right in? So same thing on the opposite side. Above the calcaneus, anterior to the Achilles tendon, and posterior to the malleolus. So kidney is medial, urinary bladder is lateral. So that's what it looks like on this side. Let me show you the other leg so you can see. So now we're on the medial side. This is kidney 3, exactly the same thing. Above the calcaneus, anterior to the Achilles tendon, and posterior to the malleolus. This is the medial malleolus. So pinch them at the same time and really get them nicely. So we did bilaterally, we did the points in the low back, and now I've come down one leg and done all the points down this leg. So now I would come around and do the second side. So I'm going to run through those points once again. I'm going to stay where I am so that you can see my hand, but now you would go to the second side. So again, gallbladder 30. Urinary bladder 36. Going just a little tiny bit faster. I guess I should slow down, huh? And then gallbladder 31. Take his finger. It's gallbladder 31, right on the iliotibial tract. And then coming down to the points behind the knee. Urinary bladder 39. I'm going to go to the popliteal crease, and I want the knee flexed to make it more comfortable. I'm going to be on the medial side of the biceps femoris tendon. So urinary bladder 39. And then urinary bladder 40 is right in the center. So definitely have the knee flexed. And my vector is going towards like the patella. And then kidney 10, this is a tricky one. You need to find 2 tendons, the tendons of semitendinosus and semimembranosus. And then you're going to press, these are my 2 tendons, you're going to press in between those tendons. And then moving on to urinary bladder 57, that's in between the 2 heads of the gastrocnemius, right at the beginning of the Achilles tendon. So I usually just falls right in there. you need a measurement, it's 7 soon from the malleolus. And then coming down, again, urinary bladder 60 is on the lateral side, which is the side that you're seeing right now. So kidney 10 is on the medial side. So they're just opposite each other, above the calcaneus, in front of the Achilles tendon, behind the malleolus. There's a nice deep hollow here. I'm not touching any of those landmarks. See, I'm holding his whole leg up. Alrighty, so there we go. All right. And then we'll move, I'll do a little bit of rolling. And good. So this next step that we're going to do, this is one of the ones where you really might consider your client's injury and whether it's appropriate or not. It's a move that they use in physical therapy. So what I'm going to do is I'm going to roll. Well, first I'll roll for a little bit before I do anything. I can be doing that right now. I can roll while I talk to you. So we're going to roll the low back, and then I'll pick the leg up, and I'll raise and lower the leg. So what that's going to do is that's going to move the low back joint, right? He's going to anteriorly rotate and posteriorly rotate, and that. Again, it might not be. I've seen it where you did a great treatment, everything's going great, and then as soon as we raised that leg up, their back went into spasm again. So, but then I've had other people have really good responses to this. So let me just take some time to really roll the low back and legs. And now I'm going to come in. I want you to see how I hold his leg. There is a truth, and that is that men's legs are much more denser than a woman's leg. So, so I'm working on a man, so his leg's a lot heavier. If you're working on a woman, this isn't nearly as hard to do. But he's not real flexible, so when I come in, I'm going to hold his leg. I'm going to bring my hand on the medial side. I just lift up, and I want my fingers above the knee right here. So I'm going to get in a nice stance. I lift up, and now I want to be able to raise and lower the leg. It's not a big raise and lower, but that's going to shorten this area right here. Now, see, his leg's pretty stable. I'm not going to worry about his leg. If he was a floppy leg, I'm not going to worry about it as long as I have a good hold on it. So I just shift my weight forward and roll this area as I raise and lower the leg. This takes a lot of physical strength sometimes. And you're raising and lowering and you're rolling at the same time, so people are like, ah, this is a lot. I'm going to come around to the other side. So again, you saw what I did on the other side. I'm going to get in my stance. I'm going to get my hand and lift the leg up so my hand is above the knee, and then I just shift my weight forward to raise the leg and shift my weight back to lower. So I might hold it up for a while and then lower. Kind of stay in the low back area as I raise and lower the leg and roll. And then I'll just do a little bit more rolling. And the next thing we're going to do is we're going to get them on their side. Okay, so I've asked my client to lie on their side. I've got a nice pillow here that's pretty big, and I'm going to bring his leg up. So I want the femur to be 90 degrees to the spine. So I don't want the leg down like this. I want it up like that, just like in pregnancy massage. And then this is a great pillow. His knee is the same height as his hip, okay? So this is where I want you to have the experience of locating gallbladder 25 and liver 13 while they're side lying. Sometimes it's easier, sometimes it's not. But what I want you to look at here is this area. See how, because this leg is up, his pelvis came forward, and what happens is the ribs can slide under the pelvis where the 11th and 12th ribs are. So, so one thing that you can do about this, and I actually had a client where I was having a hard time finding these two, and this pillow placement actually said she actually requested that I do it all the time. So a little bit of adjustment. I'm just going to move this pillow so that we can do it. And what I'm going to do, so have you ever seen those half bolsters? It's like a half moon bolster. This isn't quite it, and it's not a very pretty one, but it's not pretty, but it's perfect. So it's a little thing. So I'm going to ask my client to raise up, and I'm going to put the pillow under so it's in between the rib cage and the ilium. Look how this space opened up. So now bring the other leg back up. So now see how there's much more space in here, and then I can come around. He's really easy to find it on. This is gallbladder 25. So I didn't need this for him, but for some people it works really well. I've actually pulled the hips apart to get it if I don't have a pillow. So this is really more for your experience of getting familiar with these points. You might prefer pressing these points in this position, or you might prefer it the other way. So again, this is the tip of the 12th rib, that's gallbladder 25, and the tip of the 11th rib is liver 13, okay? Now with all that set up, I'm gonna go ahead and take this pillow out. And do what we came to do. So we're going to do a spinal twist. Notice his hands under here. So what I do with my clients when I'm in the home is I take the face cradle pillow off and I offer it to them. Would you like a pillow under your head? There. See how that's just a little bit more comfortable. Okay, so we're going to do a spinal twist. And that means that I'm going to stabilize the hip, and I'm going to rotate so the shoulder comes back. I prefer my body to be on the same side as the table because my body is going to have a block. If I go to the other side and push his shoulder away, which might give me a little bit more leverage, there's just the smallest possibility of pushing them off the table. So I'd rather have my body blocking their way. So I'm gonna have one hand, and this is where stretching is something that you really, really have to get a good, strong sense for. You have to feel their body, and when you begin to feel resistance, you need to stop and check in and make sure that you haven't gone too far, because you never want to go too far in stretching. So you might have someone and you'll just start and they'll flop right into the twist, but you might have someone that can only go a little ways. So really pay attention to the body that you're working on. Okay, so I'm gonna come in and I'm gonna get my hand on his shoulder and I'm gonna start guiding him over. And sometimes I'll hold on to the wrist here. Sometimes I just let the arm flop. So I'm just gonna, see he's moving a little bit nice. I'm gonna get in a stance, so I'm using my elbow to hold his hip in place, and I have to make sure that it's not pokey. So now I'm gonna come in, and I'm gonna go ahead and let his arm go down, and then he'll adjust himself. And then I'll tune in. This feels like a good place to hang out. So I'm going to stop and say, are you feeling a stretch here?
A little bit.
Would you like to go further?
Sure.
Okay. So now I'm going to switch, take my hand here. I need a little more leverage. I'm going to come in and then bring your shoulder down. I want to press right here, not on the head of the humerus, but right here by the pec. So pressing down. If they easily come all the way down, then I would add in pushing the pelvis away. But usually I focus first on bringing the shoulder down. And remember, a stretch, you need to hold stretches for minutes, not moments. So allow them to hang out. After a few minutes, they might be ready to go into a deeper stretch. For those of you who practice yoga, I'm sure you've experienced this where you're holding a pose, and after you've held it for a while, you can go a little bit deeper into the pose. So that's the case here. So we'll hang out. And then, okay. And then slowly come out. I usually bring their arm up and then guide their shoulder up. And now we're going to go through and go to the other side. So I'm going to ask my partner, I'm going to come and get the pillow and ask my client to get on the other side. So I could, now again, I want to remind you, so because the leg is up like this, it's going to lift the pelvis up and the rib cage is going to go down. So on him, he's a large enough person where you can actually see my fingers are in between his rib cage. I don't know if you can see that, but see how my fingers disappear. Let me just say that. So my fingers are in between. So I don't really need the other pillow to bring it here on him. So I'm not going to go through that because you saw me do it. So I'm just going to come in and find the tip of the 12th rib is gallbladder 25, and the tip of the 11th rib is liver 13. So notice how they're on the same plane, right? They're level with each other. One's more anterior, liver 13 is more anterior. So I want you to find those points. Again, you might prefer doing sideline, or you might prefer it doing it face down. So once you've done that and you've pressed them, you can just hold on to them if they're super tender. And now I'm going to do the spinal twist. So I'm going to guide his hand up. I'm going to go ahead and start with my elbow and just see how he moves. They can be very different from one side to the other. I'm going to let his arm, see how he self-adjusted, so that's fine. I'm going to push a little bit more. He's more flexible on this side. He's coming to this side pretty easy. I'm going to just move that pillow for you. And his shoulder, he came down much faster on this side. His shoulder is to the table. I'm just going to hang out here. I think if I asked him, he'd tell me he could go further, but I just, yeah. But I want to hold him here for a little bit and then come in, and then I'll see if I can, let me show you a variation on this. Sometimes I come in with my forearm, and again, I don't want to be on any bones. I want to be right on the pec. I come in. If I need a more leverage, I'm in my bow stance, I can come in with my forearm, and I can lean my body in, and then push away here. Is that elbow okay? Just need to make sure that you don't press too much with the elbow, and I'm pushing away. This, I just thought of something. So I am ever so slightly thinking of his pelvis going that way and his shoulder coming this way. What can happen, I'm just going to use you as an example. So what happens if you don't, sometimes students twist and they kind of shorten this space, right, instead of lengthen it. And what happens is that the feedback from the person receiving says, it pinches me. So if you get the feedback that you're doing a twist and it's a subtle thing. You're ever so slightly, instead of, if you go straight or upwards and you come down slightly, it will pinch the back. So it's a subtle move, it's not a big move, okay? So I'm gonna come in and he's coming forward, but I'm kind of vectoring the same as his femur and then coming down. So that's just something else that can happen. All right. So now we'll hold it, let them enjoy the stretch, maybe go a little bit deeper. Watch their breathing. They might release on an exhale, so you would follow them into a deeper stretch on each exhale. Some people like to synchronize their breath with their clients. That can be helpful. All right. And then we'll slowly come out of it. And then we'll come and get your client lying face up. So now I've got my client lying face up, and I'm going to come in and take some time to roll the quads, the front of the body. So I'm up here by the as is. So as a transitional move, maybe I'll come in. I'm just trying to find a way to be fluid to come to the other side. So I'll just roll. I mean, I could always just do some passive joint movement or something like that. But then I want to come in and get the second side. So now we're going to do some stretches for the low back. So one thing the low back really, really loves is bringing the knees into the chest. So we're going to do single leg on either side, and then I'll show you double leg. So I'm going to pick the leg up. So there's a variety of ways that you can hold the leg. I usually hold the bottom of the foot when I do this first part, and then this hand is on the lateral side of the knee because I want to bring the knee in as close to the chest as I can. Don't assume that everyone can bring their knee all the way in. If you have someone that really has a serious, like a herniated disc or something like that, their range of motion could be really small. So be mindful. So I'm going to come in, and the reason why I like my hand on the foot, I'm in my bow stance, is all I have to do is just shift my body weight and and I'm pushing here. So I'm just shifting my body weight and pushing. So first I'm just going to come a straight flexion, straight in and hold it. And then I'm going to come out. So that was his range of motion. You might go further, you might not go as far. And now I'm going to come out a little bit more lateral, just a little bit, and then come in and go again. And then I'll come out and just a little bit more lateral and go out. Again, I'm using my body weight. I'm not using my strength, just my body weight, only my body. All right. So now I want to do some hip rotations, some leg rotations that feel nice. So now I'm going to switch by holding the heel, and then I like to get my forearm underneath. So my hand is like this, and then what I can do is that I lean back and then push forward. Lean back, push forward. So nice big circles. And again, you can go in either direction. Go to the second side. I'm going to come in and bring the knee into the chest. Again, I like my hand on the lateral side. My other hand's on the plantar surface of the foot. I'm going to get it in a nice stance. And the first one's going to be straight inflection. I'm just going to lean my body weight in. And always be mindful of their clothes. So usually the pant legs have to move a little bit. So come in. And then I'm going to come out. I'm going to let his leg come out a little bit lateral, and then again use my body weight coming in again. And then coming out, a little bit more lateral, and then go in again. And then I'm going to switch my hand placement and get my forearm under there. You're going to see my back now, but it's going to be good because you'll see me, I'll lean forward and then lean back. Forward. So this last stretch is really what the low back loves. You can recommend to your clients, if they're having low back pain, to bring their knees into their chest, and that's going to lengthen the muscles in the back. It also makes your pelvis posteriorly rotate, so it lengthens the low back. This move is the best move for the low back. So if you can't climb on the table, which if you're employed by someone you probably can't, you're not going to be able to do this. You're just going to have to be okay with doing one leg at a time. If you're a big, strong man and you're working on a very small person, you could lift both of their legs. I can't do it on him. Maybe I'll show you and pretend that I can do it. But let me show you this way, because this way is the best. So I'm going to come in and put his feet on my stomach. Just let me do it. Okay. Then I get my hands under the knees, come in. And again, I'm going to be mindful. So here's the trick. This is important. Get your hands in front of the knees and pull into your stomach. And that's going to stabilize their body. And it's going to give them the ability to let go a little bit more. If I just have my hands here, let me just say, if I'm working on a gentleman or a woman, but if their legs want to be out, I let them be out. It's usually more comfortable for them if there's space between the knees. And then just coming in and moving in, leaning your body weight. Again, I'm pulling in. I might rotate to one side, rotate to the other side. His feet are pretty big. Let me show you. Go ahead and hold yourself up. So you could angle the feet out a little bit like that if their feet are really long. Thank you. So this doesn't feel comfortable to me, but some people prefer that. I like this better. And then come out. So I had a client who had herniated disc. This is what I did the majority of the treatment, is that and her range of motion was like that. And then I would move in to her limit, and then I would come out. So I spent a lot of time doing this for the client. All right. So let me come out. And lay your feet down. So if this was a really small person and I was a really big person, he'll help me out, is that I'll be able to come in and then get my hands under here, my feet here, and then do this. I definitely, this is not good for me. The other way is much better, but this is another option that you could have to bring both legs. And then that way, both of your feet are on the floor. So we end with the best move, the healthiest move for the back, the move that's really, really gonna help them. But now that you've worked on their back, it's all relaxed, now they'll be able to stretch and get into a much nicer stretch. So there is the back treatment.